Shibinda ban yele persha ya jingpang TV pat ban sapreng ya khubor sa kishnong kitha hulo kidak kishin pat kila jingya da ya ni jingpang ka office jong district tuberculosis officer Riboy district manda ka sngi kila yo ban Paidbah ya ka program ban sapreng ya khubor sa ki Paidbah halo ka ni jingpang ya ka blatip 100 days of TB awareness campaign ya ka te program la pelong hapo science hall nongpo pat lawan ban Paidbah du ba meral bonds im bolong wemeli jong kanong po constituency kumu kongsan hagajing don lang ka kong bi rani ADC Riboy district kum kasembut kongsan pat laya don lang ru Dr. E Kalwing district tuberculosis officer Riboy Dr. D Bla medical superintendent civil hospital Nongpo Dr. B Lightplang district MCH Dr. Angel JU Khadrut district medical and health officer lambat kiwe hagani ka sngi ka office jongo district tuberculosis officer Riboy district la Paidbah ki atli ki ambulance ki ban ledrung shaman lagi chnong ki prepare jo ki dong ban ki than ga Riboy na kamanta ban pin saprang ya ka khubor halo ka jingpang TB da ka jingthmu ban rat ding khong ya ka ni ki jingpang na ka lang ka office kala samru ya ki kusnam se ki company ba ki rushimet ki bladon banta ha ka ban tingkhun ya ki nongpang TB da ka ba pinbyang ya ka marpam ha ka por ba ki di ya ki dawai ini ki nong tingkhun ya ki nongpang TB le ne ka niksha mitra ki kunthop ya uba sosne sotun uba de wemele ki jirang mathan alloy limited shiam ferros century limited pioneer carbide limited nizone pipes and NTC structure but ka umroy madan VHC
Iaka jingpang TV Jerho pusni patka jingpang lapang Iaka jingya
and all stakeholders in enhancing equal access to TB care in my state. Which will lead to elimination of TB and thus contribute in making India TB free. Thank you.
Despite of all these challenges, we have seen different policies have been framed in the early 2000s, where the National Rural Health Mission, one of the very important missions that has been launched to address healthcare system within our country. We have seen significant changes in terms of infrastructure, in terms of facilities, in terms of equipment, and how to tackle all these issues within our state. And today we are here to launch a very important campaign that is against tuberculosis, jingpang TB, which is very much prevalent within our state. The effort that has been taken in the past, we have seen today while presenting the award to the different nature mitra who have supported to the TB patient. And we have seen the participation of different communities, civil societies, NGOs, and especially ASHAs, who are there at the ground to bridge the gap between the health system and the public at large. We cannot deny the fact, despite of many challenges which is there, due to shortage of manpower, due to shortage of resources with the government, it is not an easy task. But despite of that, in the budget provision for the year 2024-25, where the state government has earmarked more than 1,971 crore, which include our revenue and capital expenditure. When this kind of issue also has been addressed, different campaign, different facilities that has to be brought into the ground, where different patients they have encountered. And it's the fact that for society we are feel shy to come ahead. That we are a TB patient or HIV patient or other patient. But despite of all those, the campaign that is launched today, I'm not wrong to say that in days to come, in the next 3 months, till March, when the 24th of March, we will observe the World Tuberculosis Day. And I hope to see that, as we have seen on the report about the 84% success rate, it will be more, it will increase in days to come. And the 5% death rate, if it can be made to zero, that is the challenge to each and every one of us. We salute to each and every health worker who are there on the ground, who have been there through thick and thin. It is not an easy task. We have different programs that have been launched with regard to HIV/AIDS within the state. We have noticed there is an increasing cases with regards to HIV positive in Khubor district. Among the districts within the state where
the health ministry from time to time has introduced and reintroduced different programs to ensure to have a more evolved way to tackle tuberculosis. Now we have the National Tuberculosis Elimination Program, which, as we have listened today, has an ambition to have a TB Mukt Bharat by 2025. Indeed, this is a very tall and ambitious objective. And I can see that our health functionaries, our doctors, our ground workers, they have a long way to go. But because the Union Health Ministry has this ambition to eliminate tuberculosis even way before 2030, because I believe that we all know about the Sustainable Development Goals, where we have a list of diseases where the ministry aims to eliminate. So, by the word TB Mukt Bharat 2025, we means that we would have India or a Bharat Mukt of tuberculosis. So this is indeed, I have said that it's a tall order. It's a very ambitious project for all of us who are involved also. But along the way, I think the treatment of TB has become more, people have been, the health care has been more accessible. And going back to history, I thought that in the past we've read of people who suffer from consumption, who are being shifted, who are being isolated to warmer climates. We read about all those things. But maybe in those days, the medical advancement was not that much and people have to be isolated. It is treated as a very fatal disease. But not anymore. The consistent missionary effort that the government has taken has seen a very tremendous change in the way we look at TB also. But as we have listened, I don't need to dwell much on what has been spoken. We've seen that the government is all out to help, to provide direct access to all the healthcare facility that is available to treat TB patients. So we've seen that there is no stone unturned that is left by the government to ensure that our population have a very healthy way of life. We all know also that in India, TB is a significant health challenge. We have over 2.8 million new cases reported annually. And to think about that is a bit alarming because we know that it's a curable disease. I'm in the fraternity of all the big minds in the medical fraternity, and I would be an outsider to speak much on the technicalities of it. But what I must share here is that we have the involvement of all the sections of the community to ensure that from healthcare to, as Thomas stated, from leaders, religious leaders, students, and community leaders, everyone around who can have more empathize or have more empathy in the elimination or in our mission against tuberculosis.
A disease that continues to challenge communities worldwide as well as and in our own district, Khubor. What are the key challenges? Some of the key challenges in that hindering the successful implementation of NTP program or NTP activities for TB eliminations are a few of these points are low testing rate. Under the program, there is high dependency on sputum smear microscopy as a primary tool for TB diagnosis. But during this campaign, we'll use a latest technology that is molecular testing by TrueNAT and CBNAT testing. And also one of the core challenges of the key challenges is poor health seeking behavior. Stigma still prevails in the community, and almost 60% of the symptomatics of TB did not seek care as per the survey of National Prevalence Survey in 2022. The next challenges is undernutrition, lack of awareness regarding the right nutrition and proper nutrition, and also due to prevalence of undernutrition in the community, especially in the Khubor district, drives the progression from TB infection to TB disease. There is difference between TB infection and TB disease. So due to undernutrition, this TB infection progressed to TB disease. Almost 46% of TB patients in the state are undernourished, and high mortality rate due to tuberculosis is due to drugs resistance tuberculosis, due to low BMI, and TB disease with other comorbidities, and delayed diagnosis and delayed treatment. These are the contributing factors to higher mortality due to TB disease. What is the significance of this campaign? This campaign is next step towards combating TB. As we have put the target 2025, but we cannot achieve it in 2025. This is to intensify the fight for the tuberculosis. This is the next step, that is 100 days campaign, which was commenced from 7th December, will end till 24th of March 2025. The main program for this campaign is to raise awareness, increase knowledge of TB signs and symptoms, emphasize the importance of getting screened, early testing and treatment completion, and reduce stigma, because there is still stigma persists due to tuberculosis. Normalize discussion around TB to combat myths and discrimination against TB patients. Encourage early detection, and during this campaign will mobilize the communities, especially vulnerable populations, to undergo TB screening and report symptoms early. Support treatment and nutrition. Ensure that TB patients complete their full course of treatment and get adequate and proper nutrition through the community support through the scheme Pradhan Mantri TB Mukt Bharat Abhiyan.